George McKay. He says he's had a sounds like he's got a joint. He says he's got a joint replacement. It sounds to me like he's had a hip replacement. He says that I'm fully recovered, and I really want to get back into things that I was interested in 10 years ago. So things that I haven't been able to do for the last 10 years because I've been in pain and disabled because of the arthritis. He says he doesn't really have any pain. He feels like he has a better range of motion than he did prior to surgery, and he really wants to get back out there, and he really wants to know, what are the things that he needs to avoid to get himself that might get himself in trouble. So this tacks on well to Diane's last question about the longevity of the implants. Somebody who is fully recovered from a joint replacement, there's very little things that they can do that would cause a catastrophic or an immediate failure of their total joint replacement. So what George, I think, is really asking is, how do I get back out there but maximize the longevity of this implant? And I think the key to that, George, is to understand that joint replacements, hip or knee replacements, are relatively sensitive to high impact activities. So if you were a marathoner before you had your joint replacement, my suggestion to you would be that you pick up swimming and you pick up biking and you enjoy walking, and then some other low impact sports, whether or not they're team sports or not, golf, tennis, etc. In saying that, however, one of the reasons we do these surgeries is to minimize the pain that you have after surgery. The other reason that we do it is to get you back out doing things that you enjoy doing, get you active again. So if someone asks me, can I never do something again? That's the only thing that I ever want to do. As long as they're aware that it may reduce the longevity of the implant, I tell them that just be careful with it. But one of the important things is making sure that you get back out there doing the things that you enjoy doing. So if it knocks a year or two off of your the longevity of your implant, and you're okay with that, then I say you go ahead and do it. You just do what you want. Okay. Great question, George. That comes into clinic all the time. Usually after, like you, usually after patients have recovered quite a bit. So at the 3 or 6 month mark, people really want to get back to their lives and what they were doing before they were disabled with arthritis.